Hello, everyone. I want to welcome you all to the March Links webinar. Before we begin, I would like to go over some housekeeping rules. The lecture will be about 30 minutes long, followed by a Q&A session. We encourage all of our participants to use the Q&A button at the bottom of your screen. Participants will be on mute for the duration of the presentation and then will be unmuted for the Q&A portion. The webinar is being recorded and will be posted to linkscommunity.org after the session. I will now hand it over to Dr. Tom Frieden, President and CEO of Resolve to Save Lives, to introduce the topic and today's speakers for the webinar.
Good morning, good afternoon, and good evening, everyone. We're delighted you're joining us, and thank you for participation in Links. Links is a growing community that will support rapid progress in cardiovascular prevention. As some of you may have seen, we announced the first round of Links one-time catalytic grant recipients within the past 24 hours. This is a collaboration among Resolve to Save Lives, the World Health Organization, and the Centers for Disease Control and Prevention and its foundation. Trans fat kills about 500,000 people every year. That's one person every minute. Replacing trans fat with healthier oils is possible and will save 17 million lives from heart attacks in the 25 years after successful global elimination. Last year, the World Health Organization launched the Replace Action Package to eliminate artificial trans fat from the global food supply by 2023 and highlighted it as a flagship project. Resolve to Save Lives partners with WHO, NCD Alliance, and many other organizations on this effort and is supporting countries to implement proven replace strategies. While several countries have taken steps to reduce or eliminate artificial trans fat, progress has been, in the past, largely limited to high-income countries. Trans fat elimination is gaining momentum. It's the first elimination program in the NCD space, and it's a true win for non-communicable diseases. All too often, people see non-communicable diseases as something like the weather. It can be described, maybe predicted, but not changed. And trans fat elimination helps to change that misconception we can control non-communicable diseases. Today's speakers are Dain, CEO of the NCD Alliance and a member of the WHO Independent High-Level Commission on NCDs, co-chair of the WHO Civil Society Working Group on the UN High-Level Meeting on NCDs, Eric Antonio Ochoa, the director at Salud Justa and the representative for public policies at Mexico Saludable, a coalition of more than 100 organizations formulating and promoting comprehensive policies to prevent NCDs, and Lorena Alamandi, director of the Food Policy Department of the Inter-American Heart Foundation of Argentina and a member of the Global Nutrition Report Independent Expert Group. They'll discuss the role of civil society organizations in trans fat elimination, the link between global and national advocacy, and provide examples from their work in Mexico and Argentina. I now hand it over to Dain.
Thanks very much, Tom, and good morning or good afternoon, everybody. It's a pleasure to be joining you for this webinar, and thanks to Resolve to Save Lives for inviting us. If you could go to the next slide, please. Today, what I'm going to do is just very briefly give you an overview of who we are as an organization. I think many of you know who we are. And talk about specifically our advocacy work, specifically our work with Resolve to Save Lives on the Replace package on TFA elimination. Just briefly, NCD Alliance has been around for 10 years. We were set up by 4 founding federations originally and now represent a network of 2,000 civil society organizations in 170 countries. Our mission is really to unite and strengthen civil society to stimulate collaborative advocacy, action, and accountability for NCD prevention and control. And we very much work closely with governments and WHO and the UN to further this mission. Interestingly, also, we have this fantastic network of national and regional NCD alliances these days in 57 countries today. So this is growing every month and is a really key platform for advocacy at the country level. Next slide, please. In terms of what we're up against, you'll all be very familiar with these numbers. Non-communicable diseases are the #1 killer worldwide and the major contributor to morbidity. And obviously the major concern with NCDs is the proportion of deaths that are premature under the age of 70, which are 40% of the total number of deaths. And obviously, we also know that the burden of NCDs is rapidly impacting upon developing countries. It's no longer a high-income country issue, with 80% of total deaths from NCDs in developing countries. And we also know that it's not just the impact on people and lives that is the concern for NCDs, also huge economic impact. It's estimated that NCDs will cost the world $47 trillion over a 2-decade period. And so the economic human health perspectives really make it a global health tsunami that we're all dealing with. Next slide, please. In terms of what binds us as this global alliance, we very much came together 10 years ago around the 4 major diseases, cardiovascular, chronic respiratory, cancer and diabetes. And we've now most recently added mental and neurological health conditions to those set of diseases that bind us as an alliance. As well as importantly for this webinar, obviously the risk factors and unhealthy diets being one of the major risk factors for NCDs, together with tobacco use, alcohol, physical activity, and now air pollution being the 5th. But also we recognise that as an alliance, as a civil society alliance, there are some really important common solutions that bind us, including the need to increase funding globally for this issue, improve surveillance and strengthen health systems. Next slide, please. In terms of how we approach it as the NCD Alliance, we focus on 4 main pillars. Global advocacy has been the bread and butter of what we do over the last decade and continues to be, really trying to raise awareness of these issues politically. Secondly, we focus on accountability. Obviously, we are an independent organisation that can really hold governments and other sectors like the private sector to account for the commitments that they make. Thirdly, an increasing area for us is capacity development. And what we mean by that is really strengthening the capacity of NCD civil society organisations and alliances at national and regional levels, which very much connects to that network of alliances that I mentioned at the beginning. And then fourthly, as any alliance does, we have a unique role in knowledge exchange, really trying to broker knowledge on policy and practice across the prevention and treatment side of NCDs, really trying to highlight what works, good practice within these areas. Next slide, please. In terms of where we've come over the last decade, you'll all be very familiar with the fact that NCDs have really risen onto the global health and development agenda. And due to time, I'm not going to go into this in detail, but some of the major milestones have been the fact that we've now got a very strong political mandate at the highest political level through 3 high-level meetings on NCDs at the United Nations. We've also got a set of global targets that governments agreed to with the 25 by 25 NCD mortality target, along with many others. Plus, NCDs are obviously now very much central and part of the Sustainable Development Goals. So very much recognised as a development issue, as a poverty issue, which it wasn't, 10 years ago. So good progress at the global level in terms of getting the issue up there for politicians and political leaders. Next slide, please. But I think one of the challenges that we've had, which really came very, very clearly through the most recent UN high-level meeting, which happened last September in New York, was that yes, we've got political awareness and leadership. Yes, NCDs are increasingly recognised as a smart and strategic investment. And yes, we've got tried and tested solutions with the best buys and obviously elimination of trans fatty acids being one of those. But what we're not seeing so far, frustratingly, is significant national progress. It's not translating down to countries. And one of the papers that was released just before the UN high-level meeting last year was the NCD Countdown 2030 paper that we were involved in, which showed that less than half of all countries are essentially on track to reach SDG target 3.4 on premature mortality. And actually, concerningly, a small number of countries are actually going backwards. So this is really the area that we need to focus on from an advocacy perspective, supporting governments, building capacity at the country level to enable them to be implementing cost-effective solutions for NCDs. Next slide, please. So in terms of how we tackle the nutrition space, we increasingly over the years have focused on malnutrition in all its forms, recognizing that we can't be focusing on unhealthy diets, obesity, overweight, without actually looking at the other side of the coin, which is hunger and stunting. And we very much see those as going hand in hand. Our focus from an advocacy perspective in this area is very much on shared problems and shared solutions, and really try and leverage global opportunities like the International Conference on Nutrition a few years ago, plus everything that's been happening on NCDs to put this issue front and centre. And it also very much connects to our advocacy on the commercial determinants of health, given private sector interests in this space. Next slide, please. Just to give you a few examples of our work in this area. As I say, one of our key roles as an alliance in civil society is to be providing best practice solutions and recommendations to governments. So we've developed a whole series of policy briefs in this area. And last year we were really pleased to be partnering with Resolve to Save Lives, particularly on the elimination of trans fatty acids. And I'll talk about that now in my presentation. Next slide, please. So obviously our advocacy really focuses on the cost-effective interventions, the best buys that WHO and governments have all agreed to. And in the unhealthy diets area, it's really focusing on reductions of salt, so through the technical package shake that WHO launched a couple of years ago. And now obviously with the most recent technical package, which is REPLACE, which is all about elimination of industrially produced trans fatty acids. So this is really where our advocacy focuses in the unhealthy diets space. Next slide, please. And how we do that, we obviously do it at the global level, through our reach within WHO and the United Nations, but we also do it through this fantastic network of national and regional NCD alliances that span all regions. Often these alliances are bringing together a diabetes organisation with a tobacco control organisation, with an obesity organisation, and they provide a very unique platform at the country level and a real partner to governments in implementation. And just to give a couple of examples of how our alliances are really moving forward in the unhealthy diet space, the Healthy Caribbean Coalition is really coalescing around childhood obesity as one of their major focus areas. ACT Brazil is conducting public opinion polling on marketing to children, labelling and taxation. And the South Africa NCD Alliance was very involved in the recent adoption of the sugar-sweetened beverage taxation in South Africa. Just a couple of examples of how the alliances are working in this area. Next slide, please. In terms of our work with Resolve to Save Lives on the REPLACE technical package, we're obviously one of the advocacy partners within this initiative, and our work is focusing on two prongs. It's global advocacy and awareness raising, and secondly, country level advocacy and support for implementation. At the global level, in terms of raising awareness of the REPLACE technical package, so far we've organised sessions at the World Heart Federation's Congress in December last year in Dubai, a specific session within our NCD Cafe on TFA elimination. And then secondly, we organised a roundtable on country experiences around the time of the executive board in Geneva. And during that roundtable, we heard different perspectives from countries ranging from Denmark, Canada, Argentina, Slovenia, and Lebanon, to really understand what the main learnings were in terms of countries moving towards elimination of TFAs. Next slide, please. But the other part of it is obviously supporting country level work. And at the moment we're working in two countries, working with Pakistan with a particular partner, Heartfile. Many of you will know Heartfile from due to the founder being Sanya Nishtar. And Mexico, which is with Mexico Saludable, which is our Mexico NCD Alliance, and you'll be hearing from Erica Chua during this webinar of the work that they're doing. In Pakistan, our work is particularly focusing on, at the moment, conducting a situational analysis in Pakistan to understand some of the policy, regulatory and budgetary frameworks that are relevant for TFA elimination in Pakistan, as well as stakeholder mapping. And then this will move to more of the kind of action areas, which is a stakeholder meeting and establishing a network of organizations to work with to push forward a campaign around TFA elimination. Next and last slide, please. In terms of what's coming up for us within this partnership, we're organising a roundtable event at the World Health Assembly on the 22nd of May, really to put this issue front and centre with policymakers during that very busy week in Geneva. As part of our country-level capacity building work, we'll be convening an advocates training on elimination of TFAs, which will include 10 advocates from across 7 countries, really trying to strengthen the capacity within those advocacy organisations for this work. We're also organising a webinar in June, which will be a nice follow-up to this one, which will be specifically focused on this issue. And we're really excited about a report that we're producing through this partnership, which is looking at case studies of countries that have gone down this path of elimination of TFA, and really trying to get to the meat of, what were the enablers, what were the success factors of what made those countries be able to go down that policy path, as well as developing a knowledge exchange network for our alliances interested in this area. So I think I'll leave it there and happy to answer questions during the Q&A segment. Back to you, Tom. Thanks.
Okay, we'll go directly on to the next speaker.
Thank you. Thank you to NCD Alliance for this invitation. I am Eric Antonio Ochoa, Director at Salud Justa and representative for public policy Mexico Saludable Coalition. I will talk about the trans fat elimination, linking global advocacy to local action in Mexico. Next slide, please. Who are we? Mexico Saludable is a coalition of more than 100 NGOs working on public health issues. Our objective is to promote change in public policies and government actions to address non-communicable disease and especially men's risk factors, diet, tobacco, alcohol, physical activity, with comprehensive approach. Recently, we work on trans fat elimination in Mexico under a grant from NCD Alliance and as a part of Resolve to Save Lives initiatives on trans fat elimination. Next, please. We have a global commitment. Non-trans fats in 2023. The World Health Organization offers governments a strategy to achieve rapid, complete, and persistent elimination of industrially produced trans fats in action package REPLACE. The WHO recommends total intakes on trans fats to be less than 1% of total energy intake. In a diet of 2,000 calories, this represents less than 2.2 grams per day. Next slide, please. We have clear with the trans fat, there is no place for improvisations. The WHO recommends a set of measures. This is the REPLACE toolkit. Is the review, promotes, legislates, assess, creates, and enforce. And we need to see the legislate, the most important measure of this toolkit. Next slide, please. Next, before, please. In Mexico, we have standard norms. And the official Mexican standard norm in a general specification for food labeling. It's mandatory to declare energy content, amount of proteins, amount of carbohydrates or available carbohydrates, indicated the amount of sugars, amount of dietary fiber, amount of sodium, amount of any other nutrient about which a declaration of properties in made or any other nutrient in that is considered important. But when a declaration of properties is made with respect to the amount or type of fatty acids or amount of cholesterol with the quantities of trans fatty acids, monounsaturated fatty acids, polyunsaturated fatty acids, and cholesterol must be declared. This is optional. This is very important in Mexico. Next slide, please. In the contents is the energetic content is the first, proteins, lipid fats, carbohydrates, dietary fiber, sodium, and additional information, other fats. This is the norm in Mexico about labeling. But recently, next slide, please. We have an agreement with the guidelines referred to the Article 25 of Regulation for the Sanitary Control of Products and Services. This is the labeling, the label in Mexico. We have the saturated fat, other fats, sugars, total sugars, sodium, before please, energy, and energy per container. This is a new regulation since 2014. Next slide, please. In Mexico, this is the last measure of the daily intake of energy, fatty acids, and trans fat with percentage contribution. This information is public, but in the initiative of this project, we need to improve these indicators, and we will see how we are making the job with this information. But in the public information, children of schools age of between 5 and 11 years, we have energy mean of 1,396 fatty acids is the 39.5 grams per day. And the trans fats, this is very important, is only 1.5 grams per day. This is official information. And in adolescents, we have in trans fats indicator is the same, is 0.5 grams per day. In adults, it's the same, 0.5 grams per day. And in the population more than 60 years is 0.4 grams per day. If we see this information, probably we will think we don't have a big problem with the trans fats in intake of energy. But next slide, please. But when we see the higher content of trans fatty acids in Mexico, we see a list of products like margarine, burgers, seasonings, chicken, Kentucky Fried Chicken, the brands are in this list, but the products is in the top in this list is margarine. Secondly, burgers with Kentucky Fried Chicken, seasonings with North Suiza, chicken, Kentucky Fried Chickens, and this we see this list, but we expect to improve the information with the present content of these products, and probably we will have in the next month present information. Next slide, please. In this project, we have 4 initial components of the grant for the elimination on trans fat in Mexico. The first is we need to build a base of indicators for understanding the problem, especially with the National Nutrition and Health Survey 2012. We are working a legal analysis on trans fats in Mexico with specifications of evolution and legal status. The legal analysis is very important, and we are sharing the strategies with PAHO. This is very important, the coordination with the Pan American Health Organization. And the third component is mapping the implementation of trans fat public policies, and we are looking the evolution of the problem in the public agenda with legislators, institutions, critical process. And the fourth component is mapping key actors, stakeholders, researchers, opinion leaders, civil society organizations. This is the initial components of the grant with NCD Alliance, with the work with NCD Alliance. Next slide, please. We are mapping key actors and critical process. Recently, last year, we have a new president in Mexico, and we have some products and some advocacy to do with the National Development Plan. This is a very important instrument, a programmatic instrument for the government, and we are working with another organizations to improve the National Development Plan. And recently, in this week, we have a presentation with about the commercial determinants, not only for nutrition, even with alcohol and tobacco, and we need to improve the strategies with the new government. And secondly, in programmatic, is very important the health sector program. This discussion will initiative in April, and we are working with PAHO and other civil and other NGOs to improve this program. And in the National Congress, we are focused in the national regulation. We need to improve the general law of health, and we are discussing the new labeling law. Recently has been presented the initiatives and includes trans fatty acid information. And in the national rules, the actor is very important, is the commissions, the federal commissions to protection of sanitary risk. And we need to to work with new guidelines and new official Mexican standard, because I think the information, as we see in the past slides, is not clear. We have problem with this information, because probably we need to improve. Next slide, please. How is this done? This is very important, because we need to strengthen the coalitions, gathering national key allies. We need to improve the measure of the public problem, because as we see, the indicators are old, and we need to review this indicator with the last national survey of nutrition. And this is very important. The third component is block interference. As Katie Dain says, we have shared problems, we have shared solutions between tobacco, alcohol, and industrialized products, and we need to see the actors, and because in the industry we have interference with all industries, and we need to combine for action. This is very important, because with legislators, with stakeholders in the new government, they need to see this public problem and take action. And I think this is very important. And the last slide, please. This presentation was supported by Belén Sáenz de Miera. This is very important. She is a researcher at University of Baja California and consultant for Mexico Saludable Coalition. Thank you very much. And this is as the network of the coalition and personal networks, social networks. Thank you very much.
Thank you, and we'll go on to the third speaker.
Thank you. Good morning and afternoon to everybody joining. My name is Lorena Alemandi. I am Director of the Food Policy Department at the Fundación Interamericana del Corazón in Argentina, and I will be sharing our role in the policy process of Argentina eliminating artificial trans fatty acids. Next slide, please. Just to give you a brief overview of who we are. We are a nonprofit organization that works in the promotion of public policies and social changes to prevent NCDs. Our working areas include tobacco use and healthy diets, physical inactivity, and harmful alcohol use. And as I mentioned before, I work in the food policy department, dealing basically with unhealthy diets in Argentina. And we do this with a set of different activities, which include policy-oriented research, media advocacy, networking with institutions, organizations, and colleagues at the national, regional, and international level. We also work on transparency of the policy process and advocacy actions, including legal actions and litigation. Next slide, please. And for the artificial trans fatty acid elimination policy, which is a topic that we are sharing today, in 2008, the NCD Prevention and Control Program at the Ministry of Health of Argentina formed a task force with the objective of eliminating industrially produced TFAs in our country. Some of the precedents for this policy initiative were the WHO 2004 Global Strategy on Diet, Physical Activity, and Health, the 2006 Mercosur regulation that included the implementation of mandatory labeling in food products in Mercosur countries, Mercosur being the southern Como market. And of course, the Rio Declaration, PAHO's Rio Declaration, signed in June 2008. So the objective of this task force was to Argentina regulating the content of trans fatty acids in food products. Next slide, please. This initiative included actors from different sectors, the public sector being led, as I mentioned before, by the Ministry of Health, but also included the Ministry of Agriculture, Ministry of Social Development, Ministry of Science and Technology, and other official bodies such as the National Institute of Industrial Technology and the National Institute of Food Products. It also included representatives from the private sector, food industry associations and chambers, and civil society was also represented mainly by consumer organizations at the time and academia. And there were 3 working groups: a scientific working group, a communication, and a regulatory working group, which was actually responsible of the regulation itself, that included a modification in the more than a modification, the introduction to the Argentinian Codex Alimentarius of a section including this regulation. As you can see in the slide, the content of industrially produced TFAs in food products should not exceed 2% of the total fat for margarines and vegetable oils, and 5% of the total fat in the rest of the food products. This was officially published at the official bulletin in December 2010, and it was to be implemented in 2012 for margarines and vegetable oils, and in 2014 for the rest of food products. Next slide, please. So with this political context, we decided to design a research study to actually see and analyze not only the political process, but how Argentina was doing when it came to industrially produced TFAs in food products. So next slide, please. So we designed a quali-quantitative study design, and one of the things that we wanted to see or to analyze was the policy process and the enablers and challenges that Argentina was facing at the time in this, with this policy. So this qualitative study design included a stakeholder mapping with the interviews to different stakeholders from the different sectors. This was conducted from 2013 to 2014, and we wanted to see or to analyze these enablers and challenges in the different stages of the policy process, the agenda setting, the formulation of the process, and also, of course, the implementation process. So just as the slide shows, some of the enablers that stakeholders stated in the interviews was the importance of the international visibility of the topic. It was in the international agendas, as I mentioned, the PAHO Rio Declaration. There was a precedent, some examples like the rationale used in Argentina as well, taken from Canada, for example. That it was in Argentina, it was part of the public and the private agenda that included an active participation of the private sector. There were already international standards, which was also very important to move forward in Argentina, and there were already availability of certain replacements. When it came to challenges, stakeholders stated that basically there were still some product niches where replacements could not be found at the time. And also one of the things that were mentioned in several of the, occasions at the interviews were the costs of replacements for certain products. And that was mainly mentioned by representatives from small and medium enterprises. And also the need for technological support from the government to these enterprises as well. Next slide, please. And what we also wanted to see is how, as I mentioned before, how Argentina was doing regarding content of industrially made TFA levels in packaged food. We conducted the first monitoring study in 2014, and we just finished the second monitoring round at the end of last year. We included leading supermarket chains in the city of Buenos Aires, and a sample of 528 products in the first monitoring study, and this last one included 1,408 products. Products that we included for this analysis in particular include 19 food categories where the evidence says that those products contain industrially made trans fatty acids. That includes local and international evidence as well. So we did this study taking photographs of the food labels and the products, and including that in a food composition database at the time. Just to mention, when we did this analysis, we were also monitoring a sodium reduction policy in place in Argentina at the time as well. So for the analysis of these products, we had to include, because we were based on food labels, we had to include two steps. First, the analysis of the nutrient fact panel to detect the presence of trans fatty acids in general. And then a second step that included the revision of the list of ingredients to actually detect the presence of industrially produced TFAs wherever the label said or included hydrogenated vegetable oils or partially hydrogenated vegetable oils as an example. Next slide, please. And this is just to give you also a brief overview of our results. We have detected a significant reduction in the last monitoring study in Argentina, with still some products, and next slide please, in the food categories that still have industrially made TFA, such as pasta products, cereal bars, alfajores, which is a pastry-made local product, and bakery products in general, sold at supermarkets. I am happy also to share all the reports of these analyses to whoever may be interested in seeing them in more detail. Next slide, please. And also, as I mentioned in my first slide, media advocacy is a great part of our work. We share with the media the results of most of our research, and this was also very useful at the moment of raising awareness among the general population, but also getting informing important decision makers about this process as well. Next slide, please. And I also wanted to share with you some of the lessons we learned and some of the challenges we found in the process, being an NGO monitoring an NCD public policy. First of all, it was a great opportunity for our team to build capacity in the technical aspects of industrially made trans fatty acid elimination policy. Most of our team had began working on tobacco control, so this was one of the first nutrition policies where we focused, and it was a great opportunity to build capacity on this. It also gave us in-depth knowledge of the stakeholders involved in the political process, maybe mainly because when we got involved in this analysis, the policy was already in place. So it was very good for us and very useful for our advocacy work to to understand all the roles and the interests and the challenges faced by the different actors involved. And another important thing was the international collaboration that was at the time, and it still is, an important tool to help promote progress in our country. Next slide, please. And some of the barriers of limitation, some of them have to do with the actual research work that had to do with the access to supermarkets, for example, that we are still unable to get data from small and medium enterprises that are in different parts of Argentina. We have mainly information from the big companies, the big food companies that sell their products in leading supermarket chains. And as an NGO, of course, I have to mention the lack of financial resources to continue monitoring and doing current analysis now, for example. And so after 4 years of the policy being implemented, what is happening with some economic aspects or impacts of the policy, or some limitations? Are small and medium enterprises still facing those limitations? Have they been able to make progress as much as big companies? There are still a lot of research questions and questions that we are asking ourselves about this policy as well. But the good news is that we are still seeing progress when it comes to actual content of food products. And another limitation has to do with the labeling information. As I mentioned before, even when you can do those two-step phases for an analysis, a chemical analysis would be the best buy to see what is actually happening in Argentina. So that, of course, for an NGO, it's a huge limitation that we're facing at the time and now as well. Next slide, please. And just to finish, I want to share with you what has been and is still being our role in this process. First of all, the importance of designing policy-oriented research in order to inform decision makers on the progress or the state of affairs of a policy, to assist in the process of policy implementation and policy design, providing governments with local evidence, help set the topic in the public agenda, as well as raising awareness among the general population, be the watchdog of all actors involved in order to contribute to transparency also in the political process, and of course keep an independent public health perspective free of conflicts of interest, provide a multidisciplinary approach, and design and implement awareness and dissemination campaigns. Next slide, please. Thank you very much for your attention, and I would be happy to answer questions as well.
Great, thanks to all the presenters for really excellent presentations, very informative and very complete. We have one question that I'll start with coming in to us. First, for Argentina, looking at the issue of, for Lorena Alemandi, looking at the issue of support to industry, we had heard that companies had some support, either in product design or otherwise, to remove products that were high in trans fat. And was there that support? What was it, if so? And did civil society have any role in pushing companies toward compliance with the regulations?
Well, I cannot directly talk about support. Maybe a government representative would be better to give you further detail on that previous process. As civil society, mostly with our media advocacy work, what we did was, like at the example I give with press releases, try to make this as public as possible. I mean, the results of our analysis. So as a way also to push industry as well to comply with the regulation.
Thank you. And a related question, do you have a sense, although we heard that monitoring hasn't been possible, do you have a sense of what the overall level of compliance or consumption is and the reduction after the initiative?
Well, I have a sense, as I showed in the analysis, of the supply of food products from big companies, because that's as much or as far as we could get in our analysis. We are still not able to have information of what is going on with small and medium enterprises throughout the country, but as some public information from the National Institute of Food Products, they are also seeing significant reductions in artificially made fatty acids.
And final question, have you been able to identify the sources of industrially produced trans fat in the country, either domestically or by import, and to track production through those means?
We have been able to detect the food products that have the higher amount of artificially made trans fatty acid. As I mentioned before, we making a review of the evidence and talking to experts, we find specific food categories that provide the higher amount of TFAs.
Thank you. And going to Mexico, question concerning the process there. Just understanding a little bit more about what has been most effective to get the interest in policy change, and what particularly has been done about the finding of very high trans fat levels in some food, for example, 8 grams per 100 grams in margarine. This looks like compelling evidence that policy action is needed. How will you use that in your advocacy work?
First, in Mexico, we need to put the public problem in the agenda, because we don't have right now the sense of we are facing a problem with trans fatty acids, and this is the first big question in the advocacy. For the coalition, it's very important the measure of the problem, and we need to improve the strategies. Secondly, because even with the National Institute of Health in Mexico, they don't see this like as a problem, as a public problem, and I think it's very important. And as we show in the presentations, we have 3 levels of incidence: the programmatic with the government, with the executive power, and secondly, with the Congress is very important with the law. For example, for labeling, for contents of products, and the third aspect is very important with the regulatory agency, and I think this is the route as we have seen in Mexico. This is very important because we are working together with the PAJO office in Mexico, and we need to share the instruments, the resource available, because we don't have a lot of money, and we need work together with the agenda.
Thank you very much. We now have 2 general questions. I think maybe Katie Dain, as well as Lorena Alamandi may be particularly well positioned to answer. The first, from Bangladesh. We at the National Heart Foundation of Bangladesh have started working with the government to formulate necessary guidelines for trans fat control. The problem is really very big here. How should we start for advocacy, as we are a newcomer at this? So, great question. How do you start on advocacy? Maybe Dr. Alamandi and Katie Dain, you can comment.
Sure.
Yes.
Yeah. Go on, Lorena. Yeah.
Okay. Yes, just as I mentioned before, it's very important to get a better sense of your stakeholders in your country, the stakeholders involved in the policy development or policy define or lack of it, and detect the different interests that it may have, and have a good diagnosis of the policy policy or intention to policy in your country, and then try to see. I think that the analysis of the food, industrially produced TFA's content in your country is also a good start point to start raising awareness and using the media also to help you as an NGO get this topic into the public agenda. I would say that those would be good start points.
Yeah, I guess just adding to that from my perspective, I think there's a few general steps that are important to think about. I mean, first one would be really being prepared with evidence, particularly carefully considering the kind of local context. I mean, obviously, through our partners at the country level, there's a lot of work being done at the moment in situational analysis of actually understanding where a country is on elimination of TFA and where the opportunities might be. I think the other kind of lesson on an advocacy side is you need to be strategic and opportunistic, because sometimes it's almost like a perfect storm happens in a country, right? Suddenly, political leadership is pointing in the right direction. You've got really strong evidence base, and you've got a really strong coalition of organizations working around it, and a kind of policy window of opportunity opens up. So I think kind of being strategic and opportunistic is important. And then I think something else that really came out strongly from both Lorena and Eric's presentations is the importance of developing a really broad base of support in terms of both, civil society coalitions. So bringing in many types of civil society and professional organizations at the country level, but also really developing a broad base politically, and trying to ensure that you've got champions for your issue across different parties in your country is really important. And I think the final lesson or kind of recommendation that I'd give on the advocacy side of things is really being prepared for industry pushback, which again really came through Lorena and Eric's presentations, and really trying to think through, what will the industry come with in terms of their counter arguments, and being prepared with the evidence base and the responses for those industry pushes, essentially.
Thank you. We're almost at the end of our hour. I'm going to combine some of the other questions that have come in and ask for very quick comments, again from Katie and Lorena. One, what's more effective, soft advocacy, negotiation and discussion with policymakers, or litigation, hard advocacy? Related to that, what collaborations were helpful? How helpful was the National Public Health Institute? And how do you deal with industry interference? So a few questions, quick thoughts before we close from each of you. Katie, anything you want to add?
Sure. Yeah, I can go first. So the first question around soft or hard, I mean, I think our kind of approach has always been, you start with the soft advocacy and see how far you get in terms of negotiation, in terms of, as Lorena was saying, agenda setting, formulation of policies. And if you get stuck, then obviously hard advocacy and litigation is a useful tool to have up your sleeve. In terms of collaborations, I would say that one thing that came across from the presentations, particularly in that we see globally, is this really important collaboration between civil society and academics, which really kind of helps strengthen the evidence base of what advocates are saying, as well as monitoring implementation, which is what Lorena was presenting on.
Great. We're just about out of time, Lorena. Is there anything essential you'd like to add to that?
Just to say that hard and soft advocacy depends not only at the policy stage, but the type of policy. For example, it's not the same a childhood obesity prevention program that or policy that in the case of sodium and industrially made TFAs, where we knew that the industry was collaborating with the government in the process. So it usually depends in which state of the policy you are and the type of policy that you are trying to push. And regarding collaboration, at the time for us was very helpful to get together with other researchers and members of the academia to get better local evidence on the issue, and also to work with advocates not only in your country but at the regional level. Very useful as well.
Thank you. Let me make 4 last points as we close. First, in the United States, if it hadn't been for a lawsuit by the Center for Science in the Public Interest, the US probably would not have taken the steps it did on trans fat. Second, thank you so much, Katie, Eric, and Lorena, for your presentations. Third, the next LINCS webinar will be on Thursday, April 18th from 9 to 10 a.m. Eastern Time on community-based care and task sharing in hypertension treatment. That webinar will be recorded, as they all are, and made available on the LINCS website following the session. And finally, as I mentioned at the outset, we announced the first round of one-time catalytic support LINCS grantees in the past 24 hours. The next round is open now with a deadline of June 15th. We'll be having a webinar and bidders conference to answer questions, and we look forward to another exciting round of proposals. Thank you all very much, and all the best.